Recent surveys have showed that the amount of time which the practicing veterinary surgeon is devoting to purely small animal practice is increasing. With this in mind, this video is designed for those veterinary surgeons who, for whatever reason, have had very little experience of small animal practice in the last few years. Now obviously it's impossible to attempt a complete review of the clinical examination of the dog and the cat in the time available, so what we propose to do is to emphasise 4 main topics. Mike is going to cover lameness and skin disease, and I will cover chest disease and abdominal disease.
In this first section, I'm going to cover the examination of lameness in the dog. It's important that a full clinical examination is performed before you go on to evaluate what might in many cases be an obvious orthopaedic problem. Many animals subjected to trauma have other internal injuries, for example pulmonary hemorrhage or pneumothorax as in this dog, or ruptured diaphragm or ruptured urinary bladder, and these may be missed if a full examination is not performed. Having eliminated the presence of more serious injuries, the dog should first be examined for its posture. An abnormal posture will usually reflect underlying pain or anatomical deformity. It is not possible to cover all eventualities, but generally speaking, the dog will not put weight on a painful limb. If the pain is severe or the lesion is in the foot may be held off the ground. If the pain is less intense or the lesion is located higher up the leg, weight may be shifted off the affected leg, but the foot still touches the ground. To check whether or not any weight is being put onto the leg, place a hand under the dog's foot and lift the other side. Abnormal posture might also be due to neurological injury. For example, the characteristic knuckling over of the forepaw onto its dorsum in this dog which has radial nerve paralysis. Contracture of muscles such as infraspinatus or supraspinatus muscle may also alter posture. Having observed the dog at rest, it is important to examine it during movement. So examine the dog walking and at a trot. Ask the owner to walk it away from you and towards you, and then to trot it away from you and towards you. And finally walk it in both a clockwise and anti-clockwise direction, and then trot it. Many causes of lameness may only show subtle changes in gait at the time you examine the dog, and it is important to be au fait with breed differences in normal gait. Turning the dog in a tight circle will help to show up any loss of coordination, such as caused by chronic degenerative radicular myelopathy. The aim of examining the dog whilst moving is to establish which limb is affected, the degree of lameness, the approximate location of the lesion, and whether there is any loss of coordination. By further examinations, you are trying to locate the site of the lesion and to characterize the type of the lesion. It is important to adopt a standard routine for examining a limb. I prefer to start at the foot and work upwards. I inspect it visually, palpate it and manipulate it. You should look for changes in normal anatomy such as swellings, local increases in temperature and evidence of pain. Care has to be taken when evaluating pain, as some dogs, for example, resent the feet being examined even if there is nothing wrong with them. If you are in any doubt about a reaction, compare the response that you get with the opposite leg. In the foot, you are looking particularly for the presence of foreign bodies, inflammation or infection. Sometimes the only evidence of a foreign body is a small hole in the pad, but squeezing the pad gently will often result in a small bead of pus being exuded, which confirms the presence of infection. Discoloration and swelling around nail beds may suggest paronychia. Joints should be flexed and extended through their full range of movement. The range of flexion or extension may be reduced or increased. There may be swelling of the joint, which can be firm, as with periarticular fibrosis as a result of chronic instability, or the swelling may be soft, as with joint distension with synovial fluid. There may be gross instability of the joint, for example following flexor tendon rupture behind the carpus, which usually results from a dog landing from a great height. In cases of rupture of the flexor tendons, and similarly in the hind leg for cases of ruptured plantar ligaments caudal to the hock joint, which is especially seen in collies, it is useful to examine the joint in forced weight bearing. When examining the limbs, you are looking for swellings, local increases in temperature, pain, increased or decreased range of movement of joints, crepitus, displacement of bones relative to each other, or other changes in normal anatomy. Swellings need to be characterized. Are they superficial or deep? Are they hard or soft? Are they involving a joint? Is the swelling attached to underlying bone or just in the soft tissue overlying the bone? The distal radius and ulna are common sites for neoplasia in older animals, and they are characterized by a painful, hard swelling above the carpus. Fractures of the radius and ulna are also common, as are developmental deformities in young, skeletally immature animals. Developmental deformities occur as a result of growth plate injury and premature closure of one of them. This leads to abnormal growth of the radius and ulna relative to each other, thus causing deformity. For example, lateral carpal valgus, which the foot turns out laterally with bowing of the foreleg. During the examination, you should palpate all soft tissue structures, including muscles, tendons, and the bones themselves. In cases of panosteitis, the only clinical finding might be a pain response when the bone is pressed. Crepitus is the grating sensation that one feels as two irregular surfaces move across each other. In joints, crepitus is most likely associated with the presence of osteophytes in degenerative joint disease, or with the presence of an intra-articular fragment, for example a cartilage flap in osteochondritis dissecans, or with bony fragments in ununited ankylosing process or some fractures. Sometimes abnormal movement in a joint may produce a sensation similar to crepitus, particularly if there is extensive soft tissue injury within the joint, that is, damage to ligaments or the menisci or joint capsule. Crepitus not associated with joints is most likely to indicate a fracture. Displacement of bones relative to each other will indicate a fracture, a luxation, or a subluxation. Other changes in normal anatomy should be noted. For example, a break in the skin surface may indicate that the fracture underlying it is an open fracture and not a closed fracture. A thorough knowledge of breed predispositions is helpful when trying to reach a diagnosis. Poodles, for example, have a predisposition to congenital luxation of the shoulder, and osteochondritis dissecans or hip dysplasia are more likely to occur in large or giant breeds. The age of the animal will also have a bearing on the likely cause of the condition. Lameness secondary to nutritional deficiencies, for example secondary hyperparathyroidism, are most likely to be seen in a young growing dog. Neoplasia, on the other hand, is more likely to be seen in an older dog. Some conditions are only ever going to be seen in certain categories of patient. For example, growth plate fractures can only be seen in skeletally immature individuals. Having said all this, you must be careful not to exclude a diagnosis just because an animal doesn't fall into an expected class of animal. Bone tumours, for example, in particular osteosarcoma, can occur in young animals, such as this case of osteosarcoma in a 3-year-old Irish setter. You should not make a diagnosis based on clinical findings alone. Radiography is very important in the evaluation of a case. I've had more than one case referred to me where a practitioner has made a diagnosis of hip dysplasia in a giant breed and advised euthanasia, and yet there have been no radiographic signs suggestive of hip dysplasia when the animal has finally been radiographed. Similarly, practitioners still regularly diagnose rickets, which is a very rare condition in the dog, without taking confirmatory radiographs. All cases of lameness should be examined for neurological function, and basically there are two types of tests you're looking for. You have to check for the presence or absence of sensation to pain. For example, you should pinch the foot to elicit the withdrawal reflex. And you can prick the skin with a needle and use it to map out an area of analgesia on the skin. This area can then be related to the nerve affected. For example, if the radial nerve is affected, it will cause analgesia of the dorsum of the foot, as in this case. It is important to notice if the animal responds to the stimulus by turning and biting at you, as this will confirm that the higher centres are getting the messages up the spine. The second neurological test is for proprioception motor reflexes. In this case of radial paralysis, on the normal side, the foot is placed by the dog onto a plantar position. On the side affected by radial paralysis, the brain is receiving messages that the dorsum of the foot is in contact with the floor and the postural reflexes do not work.
The patellar reflex in the hind leg is another useful diagnostic test for neurological function. Turning now to paraplegic cases, the examination you make on an animal will help you to assess the degree of neurological deficit. An animal which has lost bladder control or sensation will have a much poorer prognosis than one that hasn't.
Foreleg lameness may also be caused by lesions in the cervical spine. Finally, I have only touched on some of the tests that you need to perform in evaluating a lameness case. In most cases, the results of these tests will only give you enough information to produce a list of differential diagnoses, and further aids to diagnosis such as radiography need to be performed to get a specific diagnosis.